Hello, I'm Dr. Amit Bhandarkar. Today we're going to talk about endoscopic spine surgery. Let's try to understand with some examples how endoscopic spine surgery is different from other traditional approaches and what are the advantages of endoscopic spine surgery. So just imagine this patient of ours has a small disc herniation just next to his nerve root. And that small disc herniation has caused him a lot of problems. He's having a lot of shooting pain going down to your legs. Now we have two options for him. One option involves going ahead and making a big incision into his back, stripping the muscles, making some holes into these bones, removing part of this bone. In the process, we may render this spine a little unstable, and then go and retract this nerve and take out that disc. This is approach number one, which we traditionally used to do by doing your open surgery. It used to cause blood loss, it used to cause a lot of recovery time. Sometimes it would create problems for the patients in the post-operative periods. And there would be some complications. Imagine if I have a new technique in which I go ahead and I'm able to localize that disc based on a X-ray or navigation where that may be, and then I can go ahead and take a small incision into your muscles and go in between the muscles and then go ahead and precisely land up into this area and put a camera in there, and through a channel of that endoscope I go ahead and pull out the disc, only that part of the disc which was causing problem, without disrupting any anatomy, any muscles, any bone, without retracting any nerves. Only the part of the disc which is damaged is taken out through a small incisions. So that is endoscopic spine surgery. Now to do that, to reach here from the traditional approach, it involved a lot of cutting edge technology. It involved a lot of understanding about how the disc herniation causes pain, how only the herniated disc which is out there, the small pathological disc, not the entire disc is a problem, only the small disc which has come out is a problem, especially when it's in proximity of the nerve. To reach there, we need to have a special instrument known as endoscope, which has a camera. It's like a pencil or maybe even smaller than a pencil, and it has a camera at one end and has a channel in there, and that camera lets us see the disc and see the nerve root, so that we are not doing anything blind. And also this endoscope is placed in the patient's body under certain kind of navigation. Most of the time it's the X-ray. Based on the X-ray, we go ahead and place it very close to the disc, we see the nerve, and then we go ahead and put some special instruments through the channel, and the endoscope provides, and go ahead and take out the disc. This is endoscopic spine surgery, and this second approach, the patient has no downtime. He goes home maybe even the same day. He has complete pain relief immediately after the procedure. And even the functional recovery or the recovery from some neurodeficit or some nerve pinching that the patient had recovers pretty soon too. And there is no damage or no long-lasting effects from the surgery. Previously, when we used to do a big surgery, when we used to strip the muscles, people would get problems as a domino effect at the other levels or the lower levels. But the endoscopic spine surgery, in certain extent, because it does not damage to all these muscles, maybe prevents that. That is endoscopic spine surgery. It's a precision surgery where we go ahead and take out only the pathological disc without any problems. So I think that surgery is going to be a norm in the coming future. It's already being accepted all around the world as the number one approach if you are practicing minimally invasive spine surgery. Among all the minimally invasive spine surgery, this approach is known as the least invasive approach for treating disc herniations. But even with endoscopic spine surgeries, there are some problems. Some problems are because it requires a special training, and it also requires special skill set. We have to go ahead and train on a different view that we get on the camera. We need to know where we are, when we are, what we are seeing. We need to go ahead and make sure that we understand where the nerve root is, where the disc is, and the person should be able to precisely place that needle initially and the endoscope afterwards at that location. So there's a steep learning curve for that, and that is the reason sometimes it's not being widely accepted. But that learning curve is becoming shorter and shorter as people are gaining more experience. People have shown tremendous amount of enthusiasm for endoscopic spine surgery. There are patients who need to be screened and they have to fit into certain criteria to be going ahead and become a candidate for endoscopic spine surgery. It's not that every spine surgery can be done endoscopically, but there are a lot of patients in which endoscopic spine surgery is the preferred approach. So if you have a disc herniation into the lumbar spine, has a good amount of disc height, the disc height is not collapsed, and you have failed conservative options, I think even the conservative options may include injections, endoscopic spine surgery can be an option for you. If you're suffering from a lot of sciatic pain and have failed conservative options, we can help you out by doing a endoscopic discectomy, and you can go home the same day. Endoscopic approaches are not only used for disc herniation, but they can also be used for stenosis. They can also be used for facet joint related pain, where we go ahead, denerve those facet joints by burning the nerves which supply them. Usually it was done by radio frequency ablation, but now we can do endoscopic rhizotomy and patient can have more long sustained pain relief by going ahead and direct visualizing those nerves and taking care of those nerves. This slowly has found its indication in the cervical spine as well, where fusion was the norm for a lot of patients. Now they can be endoscopically decompressed without disrupting the vital muscles of the neck. So this surgery is the least invasive, muscle preserving, enabling the patient to go home the next day, excepted the reimbursements vary, and that may sometimes dictate the surgeon's adoption of this technique. For us, we have seen that this technique gives great amount of results to our patients, and once you see those results, you're not going back. For my patients, I feel that if I go ahead and open that patient for a case which I can do endoscopically, I think I carry a certain amount of guilt for that patient, because I know I have damaged some of the muscles by doing open surgery on him. So our preference is to do endoscopic spine surgery because it's good for our patients, because they return to work earlier. There is no damage to any normal structures. There is no residual problems that they will carry around with them. There is no burning of bridges if you do endoscopic spine surgery. So if you are the person who is having a radical pain or pain shooting down to your legs with a disc herniations, you can just come back and see us, and we can see if you are a candidate for endoscopic spine surgery. We can work with your insurance to get those things approved, and there are a lot of options that we can pursue with endoscopic spine surgery. At the end of the day, endoscopic spine surgery is a way of thinking, is a way of being minimally invasive. It kind of further adds a new instrument into your armamentarium because you think minimally invasive. So that mindset is very important. Endoscopic spine surgery just becomes a tool or a new approach for it. Only I will say at the end of the day is that endoscopic spine surgery is a good option if the objectives can be completed or achieved for which the surgery has been told to you. If you cannot go ahead and achieve those objectives, then maybe endoscopic spine surgery is not the best thing to do for you. You may still be a candidate for an open surgery because the burden of the disease that the patient might have is so extensive, involving multiple levels, or so severe that endoscopic spine surgery may not take care of it. So we have to go ahead and evaluate the patient, and after evaluation, studying their MRIs, examining them, then only we can determine if the patient is a candidate for endoscopic spine surgery. And most of the patients who are early in the phase and who do not wait for a long period of time for their discs to really completely collapse, those patients are better candidate and better served with endoscopic spine surgery, where it can go ahead and offer you a cure rather than putting a band-aid for a bigger surgery later on. Please let me know what you think, or if you have any questions, we would be more than happy to answer you. Again, this is Dr. Amit Bhandarkar, and we do endoscopic spine surgery at Chesterfield. We may be the only few spine surgeons in Chesterfield or in St. Louis or even in Midwest at this point of time who are trained and do endoscopic spine surgery as a part of our practice. Any further questions? Please do reach out to us. Thank you very much.